Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Izzat Rusdi bin Ahmad. Today, I would like to present about how to evaluate the anti-fatness of antimicrobial agent. What is antimicrobial agent? Okay, antimicrobial is an agent that kills microorganisms or stop their growth. Mean antimicro can kill other microorganisms or stop their reproduction or growing. Okay, antimicrobial medic can be grouped according to the microorganisms that are primarily against. For example, antibiotics are used against bacteria and antifungal are used against the fungi.
Assalamualaikum, my name is Nur Shaira, metric number F21B1179. First of all, I thank you for who's coming here today. As you can see on the screen, in my presentation today, I will focus on three major points. Next is about introduction of antibacterial drug. What is antibacterial drug? Antibacterial drug that is able to kill or slow down the growth of such a disease affecting bacteria. And second point is a natural or synthetic, which is naturally procured from microorganism that repress the growth of the microorganism with antibiotic. And synthetic are made in lab by bioengineering. In an history of antibiotic introduced in year 1940, so with that, it's been 81 years antibiotic with us. Then I will go on to highlight about a classification of antibacterial drug. As shown, is the example on the figure 1. They have two groups, which is group A is beta-lactam and a group B is aminoglycoside. Therefore, about type of action, whichever there are two categories is a bacteriostatic and a bactericidal. Furthermore, about spectrum of activity, there are two sections: is a broad spectrum and a narrow spectrum. Finally, utilization of antibacterial drug is very important to medical, including surgery and for chemotherapy. Next, inability of antibacterial drug is they can treat the virus, for example, is flu and cough. Last, about side effect, we can exposure to diarrhea, vomiting, rash, upset stomach, and a fungal infection in our mouth, digestive tract, and a vagina. Thank you.
Assalamualaikum, my name is Zairi Natasha. Okay, I continue with antifungal medicine. Fungi can be found throughout in the world in all kind of environments. Most fungi don't cause disease in people. However, some species can infect humans and cause illness. Antifungal medicine, also known as an antimycotic medication, it used to treat fungal infection, which must commonly affect our skin, hair, and nails, and others. There are two types of antifungal. First is local, and second is systemic. Local antifungal are usually administered topically or vaginally, depending on the condition being treated. And systemic antifungal are administered orally or intravenously. Okay, there are four types of antifungal medication available, namely topical antifungal such as cream and gel. The second is oral antifungal such as capsule and tablet medications, and then intravaginal antifungal procedures as such as soft and small tablet that can insert into the vagina, and the last one is is an intravenous antifungal that is usually injected and obtained in a hospital. Okay, how antifungal medication work? Antifungal medication can work in two ways: by directly killing fungal cell and by preventing fungal cell from growing and multiplying. Okay, part of the cell the antifungal drug target include the fungi cell membrane and the fungal cell wall. They are both protective part of the cell that can cause the cell can leak and then die when damaged. And lastly, human bodies don't have this structure. Many antifungal drugs can target the fungi without harming the body cell. Okay, that's all from me. Thank
Next is antiviral agent. Antiviral agent is a drug that improved by Food and Drug Administration for the treatment or control of viral infection, and it also protects from spreading virus to others. Some of the antiviral agent is antiviral booster. Antiviral booster is conjunction of other antiviral drugs to enhance or increase their effectiveness. One of the example is COVID-19. Next is antiviral combination. Antiviral combination is combination of other antiviral agent to reduce the risk of resistant virus strains from emerging. The example is Harvoni. Other than that is other antivirus. The antiviral agent is a drug that only active block against influenza A, which is rimantadine. Antiviral agent works by inhibiting the development of viruses, and it also suppresses the virus ability to infect and multiply in our cell, and also boosts immune system by helping it fight off a viral infection. The efficacy of antiviral agent prevention of influenza is 60% to 90%. Antiviral agent also shorten the duration of illness when given within 48 hours of the symptoms. Thank you.
Assalamualaikum and hi, my name is Nur Izzah binti Shamsir. So I will be presenting on topic anti-parasitic drug. So what is anti-parasitic drug? Anti-parasitic drug is a group of medications that we use in the management and treatment of infections by parasites including protozoa, helminth, and ectoparasites. Okay, so there are 4 types of disease. The first is malaria. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. The second is pneumocystis. Pneumocystis is a serious infection by the fungus that we call is Pneumocystis jirovecii. The third is trypanosomiasis. Trypanosomiasis, we also known as sleeping sickness. It is caused by the protozoan parasites belonging to the genus Trypanosoma. And the last is scabies. Scabies is an infection of the skin by the human itch mite. Okay, so there are 4 types of anti-parasitic drug. The first is piperazine. Piperazine we use to treat roundworm and pinworm. The second is amodiaquine. Amodiaquine is an anti-malarial drug. The third is furazolidone. Furazolidone is a drug for the treatment of infectious diarrhea. The last is mebendazole. Mebendazole we use to treat of helminth infections. So how the anti-parasitic drugs work? So anti-parasitics target the parasite agents of infections by destroying them or inhibiting their growth. So that's all from me. Thank you.
Okay, conclusion. There are many type of antimicrobial agent that we know. Okay, there are specific antibacterial agent that kill specific organisms. By the way, the agent are by killing the inhibit growth in epidemic put it. Okay, from concentration and length of contact with the target microorganism. Addition, metabolic state of target microbe can affect its response. Okay, the antimicrobial agent target dormant cell or cause the flow to affect them to prevent their growing cell. Okay, for lastly, if you know there are many type of antimicrobial that have used today, and it will be help we on for medical and many of that.